Postpartum IUD. Pregna International Limited presents the Postpartum IUD. The video describes postpartum IUD method, its advantages, postpartum IUD insertion, existing method and postpartum insertion using Pregna PPIUD with advantages. Immediately after childbirth, woman has the highest motivation for accepting a long-term contraception. In postpartum IUD method, IUD is fitted within 48 hours of displacement of placenta. This method is convenient to the user. She does not have to return to the health facility. Cervix is sufficiently dilated postpartum, hence no discomfort to the lady having the IUD inserted. Absolutely safe for lactating mothers. No additional pain, bleeding and cramping. The video will show the method of insertion of postpartum IUD in traditional way and compare it with the use of Pregna PPIUD. Gently clean cervix with antiseptic solution using cotton swabs. Visualize cervix by inserting a Sims speculum in the vagina. Gently grasp the anterior lip of the cervix with the ring forceps. Open the inserter pack and hold the IUD with forceps. Apply gentle traction to anterior lip of cervix using ring forceps. Pass the IUD carefully through cervix into lower uterine cavity. Once the IUD is in the lower uterine cavity, move left hand to the woman's abdomen and gently push the entire uterus upward. Gently move forceps with IUD upward towards the fundus following the curve of the uterine cavity. Release the IUD. Perform hand hygiene and gently clean cervix with antiseptic solution using cotton swabs. Now showing the PPIUD insertion using Pregna PPIUD. Gently grasp the anterior lip of the cervix with the ring forceps and pass the PPIUD inserter carefully through the cervix into the lower uterine cavity. Once the PPIUD inserter is in the lower uterine cavity, move the left hand to the woman's abdomen and gently push the entire uterus upward. Gently move PPIUD inserter upward towards the fundus following the curve of the uterine cavity. Move the flange upwards to release the thread. Release the IUD at the fundus. Withdraw the insertion tube from the cervical canal until the string can be seen extending from the cervical OS. Use sterile scissors to cut the thread. Now the comparison of Pregna PPIUD versus existing method will be described. With Pregna PPIUD, single-use disposable inserter. With Kelly's forceps, introduction of steel forceps in the uterus. With Pregna PPIUD, IUD completely contained in the inserter. With Kelly's forceps, dropping the IUD midway in the uterus. With Pregna PPIUD, suture is long and locked with flange. With Kelly's forceps, entanglement of the thread with the forceps arms. With Pregna PPIUD, no need to sterilize. With Kelly's forceps, sterilization of the forceps is cumbersome. With Pregna PPIUD, minimum handling, hence prevention of infection. With Kelly's forceps, potential of exposing user to infection. With Pregna PPIUD, the suture is long and visible in vaginal cavity. With Kelly's forceps, threads in the existing design are small. Pregna PPIUD. Doctors in India reported increased convenience and effectiveness by use of new inserter. PPIUD development took many trials over 3 years by a renowned USA gynecologist. Pregna has developed a new inserter for postpartum IUD. Right type of facilities, skilled personnel are available at hand. Advantages of Pregna PPIUD inserter. It is a single-use, disposable inserter. IUD is completely contained in the inserter. Suture is long and visible in vaginal cavity. For the Pregna PPIUD, there is no need to sterilize. It requires minimum handling, hence prevention of infection. The postpartum IUD.